Good morning. My name is Hani Jama. I am a dental surgeon at Silicon Valley Dental Center here in San Jose, California. Um, Today I'll be talking about actually a very important subject. I have seen this issue has been mounting in the past few years, and it has been more intense actually this year. And it's about the dental tourism, and or it's mainly for people who travel back to the Middle East or back to their countries, the people who actually reside in a country and travel to a different country where the dental or medical treatment is cheaper. When I talk about dental tourism, I'm more specific about big cases. I'm not talking about going to Turkey, for example, or going to Pakistan or going to India. Now you live, let's say you live in Silicon Valley and you have 2 weeks vacation and you go there and you get your dental cleaning done. I mean, this is not a big subject or big issue. I mean, this discussion today is focused on the people who actually live in one place, such as the Silicon Valley, and then travel to a different country and do their surgeries in that country. So we will start with the definition. I believe we all defined it clearly, and the major issue we have is what kind of dental treatments or surgical procedure that the patient will need. So for example, some treatments such as dental implants, for example, somebody has bad teeth and many of his or her bad teeth need to be extracted, and they need to build bone, and after building the bone, which is like the concrete foundation, they want to go with the second level of having implants, and after the implants they will have the bridges or the teeth. This process, for example, will take about a year. Sometimes some medically compromised patients might need a little bit longer time, around 18 months. Okay, I'm just saying average. The problem is this: people go to Pakistan, people go to Turkey, people go to Jordan, and they have only 2 weeks, maybe a month if they are lucky. And what they do, they tell the doctor there, hey, I need full mouth of implants and I have 30 days. And here's the problem. We have seen doctors that say, yes, we can do it. And the poor patient, instead of having good time with his family, he is having multiple surgeries in 30 days, living in pain and agony. And he come back, and when he come back after 30 days with a full mouth of implants, we here as doctors or surgeons or dentists, we start seeing the complications. And we have to deal with it or work around it. I'll give you an example. There's a story that happened. Well, it's a patient of mine actually. She came to me about 2 years ago, and she needed implants. It's a lot of work. She had broken teeth, and she is a young lady. She's in her, I believe she's in her early 40s, and she was in need of pulling all of her broken teeth. I mean, not all, most of her broken teeth, rebuilding her jawbone, and then placing implants. And after healing of the implants, she will need some bridges that connect these bridges of teeth that connect these implants together. So the process, as I mentioned before, it takes up to a year, up to a year and a half. So there is two components of this treatment. Number one, we will need the time, because time literally heal. So we need the time for this surgery to heal. So, and we have here two major surgeries, actually three major surgeries. We have the surgeries for the extractions, and then we have the surgeries for building her jawbone with natural human bone. We call it bone grafting. And after that, the third surgery would be the implant placement surgery. And sometimes we do a fourth surgery where we expose these implants, but this is not a major one. So what happened is, these surgeries take up to, again, a year to a year and a half, and each surgery takes its time to heal. So after we extract the teeth, and then we build the bone after the extraction. And this process will take for 3 to 4 months, sometimes with medically compromised patients, 6 months. So this is the foundation. We lay the foundation for this patient, and many times we use fake teeth or dentures for them to be able to walk out and smile. So here we have 6 months, and then patient come back and we place the implants, and the implant placement will take another 4 to 6 months of healing. So here we have a year, and after that we do the constructions of the bridges over the teeth over these implants. And as a result of this process, time is important, and there is an important component, which is money. It's financials. This process is not cheap, and I tell people, like, how much, doctor? Well, I tell them depends on the case, but when you go to a full mouth reconstruction surgery like this, it will cost you a price of a new car. Now, it depends how is your taste with cars. If you like, German cars, maybe it's a used German cars. If you like Japanese cars, so maybe it's a new Japanese car. I'm just giving you an example how intense these treatments with surgeries and financials as well. So the patient goes to I'm sorry, there's a message here. The patient goes she goes to her country, and the doctor will do it for her in 1 month. So what do you expect? The best example I can tell people about implants on full mouth reconstruction is like building a house. Literally, it's a process like building a house. You cannot go with the first floor without having a foundation. And with the foundation of the house is maybe a cement foundation or a concrete foundation. The concrete is made of cement, and the cement, you mix water with the cement and some gravel. You mix them together with certain ingredients, and you pour them on the basements, and you have to wait. You have to wait for that cement to sit before you go with the first floor. So some of these doctors, what they do, they just simply pour the foundation, and while the cement or the concrete is still soft and it's not hardened enough, they go with the first floor and second floor. So anyway, making long story short, patient come back to me. Patients came back from her country, and when she came back from that country, she was embarrassed to talk to me because her face was bluish and reddish and swollen, and she was miserable, and it was sad. And then she was embarrassed to talk to me, and then she called me after 1 year when she could not hide the complications. So this is the complications. So she had the implant failed, the bone under the implant was infected, and there were pockets of pus and abscess around the implants that resulted in severe pain, infection, and foul smell from the mouth and foul taste that has led to her body to deteriorate. Remember always, the mouth is a reflection of a good health, and there is a strong relationship between the mouth and the health. So she came back to me, and after assessing her situation, we realized that her condition, we need to redo the whole, we need to do 2 surgeries, a surgery to fix the damage, and another surgery to reconstruct. So now, instead of costing a price of 1 new car, is going to cost a price of 2 new cars. Again, for example, expenses wise. And that became very frustrating for her and very frustrating for me, because let's think about it. What make people go to a cheaper place overseas to go through the pain of ruining their vacations and getting all this work done? To save money, or they don't have enough money to do that. So now, in her case, unfortunately, oh, that's a white color. Well, that's neat. Let's keep the white. So in her case, as a result, Her treatment has to be doubled, and it was very frustrating. I'm going to give you one more tip, my friends. Uh, Doctors do not like to mess with a failure case. So if the patient go to a doctor overseas, and that doctor misses your mouth, and you come back with a messy mouth to another doctor, that doctor will not touch it most of the time. Why is that? As a doctor, as an oral surgeon, as a dentist, when I come and work in your teeth and I put my hands over your teeth, I own your teeth. I'm fully responsible for your teeth. So if the tooth is messed up by a different doctor and I put my hand, who is more responsible for the damage? It becomes a little bit messy here. So doctors will tell you, go back to the country or the doctor who did the work for you and let him fix it. He's responsible for that. So it becomes more frustrating for the patient who is back to America, to his main home now, and he has to go back and travel all these thousands of miles with all these expenses in the middle of his work schedule, go through all the pain and deal with it. And one more tip I'll tell you: most of the surgeons on these countries or in these dental offices where patients go, when somebody make this mistake by doing unethical work, they will not stand behind you. They will not support you. They will say, you know what, it is your fault. You'll blame me for all these problems. So at the end, you're not going to get anywhere. The consumer is not protected in most of these countries. And at the end, you are a foreigner, or maybe you're actually a citizen, but the systems are, as you know, it's messed up, and nobody's going to actually take care of you, especially when the damage goes to that extent. So brothers and sisters and my friends, this is very important to keep in mind. Please, and this is my advice to you, pick your doctor, any doctor, okay? Especially when it comes to major work like this, your dentist, your physician, your heart surgeon, whoever he is, pick that doctor to be local. Do not pick a doctor that's far away from you. Pick a doctor that's, I would say, half an hour drive from you, maximum 1 hour drive. But beyond that, please don't do that, because if you have an emergency, if you have complications, are you going to travel to Pakistan or India or Morocco or Egypt to have the doctor deal with that? I mean, honestly, if you go to Egypt and have a crown done, you know, having just a simple crown, what it takes from steps, you have to make the crown, and then there's a temporary crown that's put there while the lab makes the permanent crown for you, or the cap. It takes 2 weeks, maybe 10 days. Let's say a week maximum. They put a rush, that crown's come back in a week. And after the crown is placed in your mouth, the doctor is going to ask you, go home, eat for a few weeks, come back to me. We might need to do some adjustment. So if you go there for a week or two on a vacation, get a crown done and come back and the crown is high or sensitive, or the tooth is sensitive, or you have inflammation, who's going to fix it for you here when you're far away from your dentist? This is another issue. Now, let's look at the root cause of why people go for dental tourism or oral surgery tourism or whatever medical tourisms away from their homelands or away from their countries. It's basically financials. Either they are very money conscious, or they don't have the money and they are desperate for change. Or some people who like to always shop around and have the best deal here and there. And so economy is an issue. So what I'm saying, let your best choice, or the goal of your treatment is, what is the best for me, regardless of the distance. So if you just imagine that you want to somebody need a heart surgery, like let's say a new heart, would you go and pick, if there's 2-3 hearts, would you pick the cheapest heart? Would you pick the Chinese heart over the Taiwanese heart, or the Taiwanese heart over the Chinese versus American heart or German heart, because this heart is half price? No, nobody think this way. It's your health. For your health, you have to get the best of everything, because your body will not accept anything but the best that's out there. The body would reject That's why when you have somebody has an implant and the implant is failure or the implant is not clean or the implant is a cheap implant, the body will literally reject that implant in a form of pus or abscess or swelling or inflammation. This is the way your body will tell you, will cry at you that, hey, I don't like it, take it away. It will give that pus, inflammation, swelling, and redness. It's a sign of not acceptance, okay? So get the best for you. So find a doctor around you in whatever profession it is. Find a doctor, let's say for the dental implant, find a doctor around you, okay, local, okay, who is good in that dental implants, who has a good reputation, who has good reviews, and don't go to him based on his prices or cheapness. You will be in big trouble. And I tell people, never go to the doctor who put on his door 40% cash discount. You will be in trouble. This is a red flag, okay? Go to somebody who actually has good quality of work, high rate of success, and good reputation. When you go, and don't ask for money, just go and see, do you like that office? Is it very comfortable place? Is it clean? Go and check out, go to the bathroom. If their bathrooms are clean, they are clean. It's like when you go and get married, you go the old school, they say people go to the bathroom of that family and see if their kitchen is clean or their bathroom is clean. Then the house is clean. I mean, old school thing. But anyway, go and check that office. Look at the front desk. Look at the countertops. Look at the bathroom. If that office is clean, talk to the doctor. See if the doctor has a good personality. If he can connect with you, if you can connect with him, if that doctor has the patience to listen to you and answer your questions without rushing you, because you are building your mouth, you're investing a lot of time and money. You have to have somebody that can communicate with you. So if you have a good doctor, good personality, good reviews for his work, good reputation, then choose that doctor, and then the next step you should negotiate. If you want to say negotiate, the next step is financial. See how much is the total treatment and say, hey doctor, you know what? If you can't afford it, I'm telling my patients, if you have a difficulty or financially challenged, if you have problem with money, just tell the doctor, you know, doctor, you guys are amazing. I heard a lot about you, but doctor, honestly, it's a little bit tight on me. And can you work something out for me? And I'm going to give you a secret or a little tip about how doctors think. This way you're prepared. And I hope dentists or oral surgeons don't hate me for that. Okay? So, now listen to me carefully. Number one, doctors are, let's say the treatment is $10,000, for example. So, when you talk to now usually doctors don't discuss financials. I don't discuss financials with my patients most of the time, okay? I have a team of people to discuss financials. But for example, you talk to the office manager or the treatment coordinator and say, hey, and by the way, just be honest with them. Just be very honest and transparent with them and say, hey, you know what, can you help me with something here? So they're gonna give you two options. Option one, they will give you a courtesy discount. I don't like to use the word discount because it's cheap, and I just don't know. I don't like the word discount. It just sounds a little bit cheap, a little bit bargain, a little bit low class. But that's the fact. We have to deal with that sometimes. So they can give you a courtesy, and it could be 5%, it could be 10%. If somebody give you a 50 and 80% courtesy, something is wrong here. I'm telling you, something is not right. Unless if he's working his car garage, okay? But an elite, good quality dental office giving you 50, 60, 70, 80%, something is not right, okay? So anyway, so they may give you maybe 5%, maybe 10%. So if it's $10,000, they'll give you $9,000, okay? However, if the surgeon or dentist give you a discount, a 10% discount, for example, you cannot finance it. You have to pay it upfront. Most of the time, again, this may not work all over the place, but this is a known custom here in the United States. Now, let's say if you cannot afford $9,000, I mean, you don't have the cash for $9,000, what would you do? Then the second thing you should do is ask them, hey, do you guys have my payment plans? I mean, I really want to get the treatment done. Show the doctor that you really need them. You are in need for their help. When they feel that with you, they'll connect and they will do everything to help you. So let them know, hey, you know what about financing it? Can you do something for me? So, and I'll give you a second tip here. Most doctors, usually, they don't do in-house financing. Like you come to me and between you and me, I'll finance the $9,000 over 9 months, like $1,000, because not many people are honest. Some people will flake on you and they will not pay. And who has the time to go to the court and run after the patient and hire a company to run after the patient so they can get paid? It's a pain, it's a headache, and no one has the time for that. So all doctors learn from this mistake. So what we do, we hire companies. So there are good companies, well-known companies who do financial arrangements for you or payments plan. One of these, there is Lending Club and there is Care Credit. Now these two companies, the Lending Club or Care Credit, for example, they can give you up to 2 years for zero interest financing, which is a good deal. So for example, if it's 9,000, maybe end up paying like maybe $500 a month or $400 a month. Could be doable for many people. Now, keep in mind, if you get zero interest financing, actually somebody is paying for it. You are, even though you're not paying the interest, but the doctor actually is paying a fee for that. So he will eat a big chunk of hit by financing your payments. So that's why you cannot ask discount and payment plan at the same time, because it doesn't work this way, because the doctor is going to get a big hit. I believe this is the major things to cover, so please stay local. Come in. Please stay local. I'll be right there. Please stay local with your doctors. Please don't travel and get big procedures like this, because you will have at a certain point you're going to have a problem, and these problems will be very intense and hard to fix, or very expensive to fix. And now I'm not against you going somewhere else, and when you go, let's say, to Turkey, or you go to visit your family in Bangalore or so, or in Jordan, if it's a cleaning, it's okay. You know, maybe a simple filling, it's okay. Emergency, you have an emergency, you have to. But any treatment that require visits and maintenance, I highly recommend you get it in the city or town where you actually live. Thank you so much for listening, and you guys, I hope you guys have a wonderful day.